Welcome to my second endodontics video. In this video, I will be talking about diseases of pulp. There are various causes for pulp disease, and they are as follows. The first one is physical causes, where we have mechanical trauma, which is normally caused by accident, like contact sports, uh, boxing, football. Iatrogenic dental procedure causes, like during cavity preparation or crown preparation. Then we have pathologic wear, like atration, abrasion. We also have cracked tooth syndrome. Then we have thermal causes, like heat from cavity preparation at either high or low speed. We have exothermic heat from setting of the cement. There are some conduction of heat and cold through deep amalgam fillings without a protective base. And we have frictional heat caused by polishing or restoration. We have electrical causes, like galvanic current between different metallic fillings in the mouth. We have chemical causes, which is phosphoric acid or acrylic monomer or erosion. Then we have bacterial causes, which is the most common cause, where toxins related to caries play a major role. We also have direct invasion of pulp from caries or trauma, and microbial colonization in pulp by blood-borne microorganisms. So we will be further studying the different details on these topics. So let's begin with physical injuries. Physical causes include mechanical and thermal injuries. Mechanical injuries. These injuries are usually due to either trauma or pathological wear of teeth. Trauma is traumatic injury may or may not be accompanied by a fracture of the crown or root. Trauma is less frequently the cause of pulp injury in adults than in children. Many times children fall down and crack their anterior teeth, which exactly is shown in the picture in the right, where we have traumatic injury leading to fractured crowns of both the central maxillary incisors. Then we have iatrogenic injury, uh, which is caused by dentists, ironically, due to certain dental procedures that occasionally injure pulp. Some are avoidable, some are not. Then we have pathological wear, where pulp may also become exposed. These are the examples. Atration, as you can see, the lower teeth have been atraded very severely, and we can see some pulp in the canines being exposed. Then we have abrasion. This is commonly due to using wrong methods of brushing teeth horizontally, using wrong kind of toothpaste which have high abrasives, and it is normally cementum that gets abraded easily, more easily than enamel, leading to pulp exposure. Then we have bruxism, which is grinding of teeth, might lead to opening or exposure of pulp and injuring the pulp. And then we have abfraction. Next reason is cracked tooth, which is incomplete fracture through the body of the tooth and may cause pain and it is normally idiopathic in nature or origin. We have barodontalgia, which is also known as aerodontalgia, which denotes toothache occurring at low atmospheric pressure, experienced either during flight or during test run in a decompression chamber. Barodontalgia has generally been observed in altitudes over 5,000 feet, but it is more likely to occur at 10,000 feet or above. Coming towards thermal injuries, heat from cavity preparation. So, cavity preparation produces temperature changes with an increase of 20 degrees Celsius in temperature during dry cavity preparation and 30 degrees increase in temperature zero point 0.5 millimeter away from the pulp. Then we have heat conduction by fillings. So, metallic fillings like amalgam or metallic crowns, which are big and close to pulp without any intermediate cement base, may conduct temperature changes rapidly to the pulp and may eventually lead to irreversible pulp changes. Frictional heat during polishing can also cause transient pulp injury, which is normally reversible. Now moving towards next category, which is chemical injuries. Chemical causes of pulp injury are probably the least common. There are some restorative filling materials that can cause pulp injury, and there are a few factors that we have to consider in order to determine whether or not the filling is causing any pulp damage. First is acidity of the material. Then we have heat generated during the setting reaction, absorption of water during the setting reaction, dentine thickness that remain after crown cutting or cavity cutting, and marginal adaptation of the material. If we have poor marginal adaptation, it might lead to bacterial leakage, which commonly happens with unfilled cements, which contract after curing and then leave some marginal openings. Coming to next cause, which is bacterial cause, and bacterial cause is most common cause of pulp injury. As for bacteria, their products may enter the pulp through a break in dentine, either from caries or accidental exposure, from developmental grooves or percolation around restoration with poor margins, or from extension of an infection from gingiva or from blood. Microorganisms play an important role in genesis of pulpal diseases. And this concludes with the different types or different ways by which pulp gets damaged. Now let's learn more about what the pulpal diseases are. So clinically, the classification of pulpal disease goes as follows. We have inflammatory diseases of the dental pulp, which are called pulpitis. We have reversible pulpitis, irreversible pulpitis. In irreversible pulpitis, we have further subcategories, which are symptomatic irreversible pulpitis, also called as acute irreversible pulpitis. We have asymptomatic irreversible pulpitis, also called as chronic irreversible pulpitis. We have chronic hyperplastic pulpitis and internal resorption. Then we have pulp degeneration, which is calcific degeneration, atrophic degeneration, and fibrous degeneration. And lastly, we have pulp necrosis. And we will be going over these in detail in the coming slides. So this flow chart shows us how different pulp diseases progress. We have normal pulp, which when coming in contact with noxious stimuli causes inflammation, that is pulpitis. Always initially the pulpitis is reversible, and if we remove the noxious stimuli, it will go back to being normal. But if we are not successful in removing this stimuli on at correct time, this reversible pulpitis will become irreversible pulpitis. Irreversible pulpitis can be of various types, So we have chronic hyperplastic pulpitis, which is also called as polyp. We have symptomatic irreversible pulpitis. We have asymptomatic irreversible pulpitis. And we also have internal resorption. So these are the four types of irreversible pulpitis. And all of them lead to pulpal necrosis. Okay. Pulpal necrosis can also be formed or caused due to ischemia induced by trauma and other stimuli causing degenerative pulpal changes. We also have calcific degeneration or calcific metamorphosis, um, which is denoted by pulp stones in the pulp canal. So, reversible pulpitis is a mild to moderate inflammatory condition of the pulp caused by a noxious stimuli, in which the pulp is capable of returning to the uninflamed state following removal of stimuli. Cause The common causes are any agent that is capable of injuring the pulp. We talked about a lot of agents, and most commonly we have trauma, thermal shock. The symptoms of reversible pulpitis are characterized by short, sharp pain lasting for just a moment. This pain is always specific to a stimulus and it is instantly relieved on removal of the stimulus. It is more often brought on by cold food than hot food or beverages, and by cold air. Best treatment for reversible pulpitis is prevention. Periodic care to prevent the development of caries, early insertion of a filling if a cavity has developed, desensitization of necks of the teeth where gingival recession is marked, use of a cavity varnish or cement base before inserting a filling, and care in cavity preparation and polishing are recommended to prevent pulpitis. Now we go towards irreversible pulpitis. It is defined as a persistent inflammatory condition of the pulp, symptomatic or asymptomatic in nature, with pulp becoming incapable of healing. We have two we have two types: asymptomatic irreversible pulpitis and symptomatic irreversible pulpitis. It is caused by bacterial involvement of the pulp through caries. Symptoms: it is symptomatic in nature and pain is sharp, exaggerated, and painful to thermal stimulus. So normally when a patient describes this pain, it is always spontaneous, continuous, lingering, and nocturnal. Treatment consists of complete removal of pulp or pulpectomy. In posterior teeth in which time is a factor, the removal of coronal pulp or pulpotomy should be performed as an emergency procedure, and surgical removal should be considered if the tooth is not restorable. Is chronic hyperplastic pulpitis or pulp polyp. It is a productive pulpal inflammation due to an extensive carious exposure of a young pulp. This disorder is characterized by development of granulation tissue, which is covered at times with epithelium resulting from a long standing low grade irritation. Causes slow progressive carious exposure of the pulp. For the development of hyperplastic pulpitis, a large open cavity is needed. We need a young resistant pulp and a chronic low grade stimulus, which can normally be caused by chewing or biting or eating. We don't have any symptoms except during eating when there's a pressure from food bolus which causes some discomfort. Treatment should be directed towards elimination of polypoid tissue, followed by extirpation of pulp, and we have to make sure the tooth can be restored, because as you can see in this diagram, normally there is a very big cavity, and sometimes there are high chances that the pulp sorry, the walls are very thin and restoration is not possible. The next is internal resorption. So resorption is defined as a condition associated with either a physiologic or a pathologic process resulting in loss of dentine, cementum, or bone. Internal resorption is an idiopathic, slow, or fast progressive resorption process occurring in dentine or pulp of the pulp chamber or in the root canals of the teeth. The cause is unknown, but mostly patients have a history of trauma. So it is also referred to as pink tooth. As you can see here, this area of the tooth has turned pink because of the internal resorption. This is an x-ray of the same tooth, and here you can see the pulp chamber has increased in size. This is the normal pulp chamber here, but here it has been increased in size because of the internal resorption. Symptoms: normally there are no symptoms. In internal resorption, we can always see a pink spot or reddish area on the crown or via x-rays. Treatment: extirpation of pulp. It stops the internal resorptive process, and we also do routine endodontic treatment. And obturation of the defect normally requires special effort, preferably plasticized gutta percha. Next is pulp degeneration. Degeneration is generally present in teeth of older people. It may also be a result of persistent mild irritation in the teeth of younger people, as in calcific degeneration of the pulp. It is not necessarily related to infection or caries, though cavity or filling may be present in the affected tooth. Type 1 is calcific degeneration, where part of the pulp tissue is replaced by calcific material like pulp stones or denticles, and calcification may occur either within the pulp chamber or within the root canal, but generally it is in the pulp chamber. Then we have atrophic degeneration. This type of degeneration is observed histopathologically in pulps of older people. We have fewer stellate cells and a lot of intercellular fluid. The pulp tissue is less sensitive than normal. Fibrous degeneration. This form of degeneration of pulp is characterized by replacement of cellular elements by fibrous connective tissue. On removal, they look like a leathery fiber. Lastly, we come to necrosis of pulp. Necrosis is death of pulp. It may be partial or total, depending on whether part of or the entire pulp is involved. Necrosis, although a sequel to inflammation, can also occur following a traumatic injury, in which pulp is destroyed before an inflammatory reaction takes place. Cause can be due to any noxious insult, injury to the pulp, such as bacteria, trauma, or chemical irritation. Symptoms: normally there is no painful symptom. We see grayish discoloration or brownish discoloration, and there is a lack of luster and brilliance in the tooth. Treatment consists of complete removal of pulp, pulpectomy, and obturation of the root canals. We also bleach the crown to bring back the original color and remove the discoloration. Thank you so much for going over the pulp diseases with me.